Okay, good morning, everyone, and welcome to our second breakfast webinar on COVID-19, and this time, at a different phase in the pandemic. So we're discussing the endgame in Korea, but also we'll touch on things regionally and globally, and particularly with relations to vaccines and also the economic impact of this closure, hopefully, and also those countries that have, adopted different strategies for their vaccination rollout. So just as a point of logistics, so if you have a question, feel free to use the chat function. Depending on which version of Zoom you're using, it may be in a different part of your screen. But if you just click on that, feel free to put in any question you like. If that question comes to mind as someone speaking, please feel free to stick it in there. I will try as the moderator to address that question as it comes, but if we cannot do it at that particular time, then we will get to as many questions as we can at the end. So today we're going to cover the likely vaccination rollout here in Korea and overseas, the emergence of COVID-19 variants and the impact that may have on these rollouts, and also the pandemic itself, and then the likely correlation between vaccination rates and economic recovery and what that means for us short term, but also more longer term in terms of the future global pandemic preparedness of various countries. So today we have a fantastic panel. And so we have Dr. Jerome Kim, who's Director General of the International Vaccine Institute. We have Dr. Deok Hee Yi, who is a health economist at King's College, and also Dr. Hyunsook Lee, who is a professor of the Department of Biological Sciences and IMBG at Seoul National University. So I would like to, first of all, ask them just in that order, if you guys can just tell us a little bit about yourselves, but particularly what it is that you've been working on in the midst of COVID-19. And maybe, can we start with Jerome? You need to unmute yourself, Jerome.
Thanks. Good morning. And you'd think that after a year and a half of COVID, I'd be able to remember to unmute myself. But my name is Jerome Kim. I'm the Director General of the International Vaccine Institute, which is actually the first international organization to be based in Korea. IVI discovers, develops, and delivers safe, effective, and affordable vaccines for global health, what we call unincentivized vaccines. So we're very much concerned with health equity. As an international organization, we have 36 member countries and WHO as signatories, with 3 other countries kind of waiting for entry. And we, during COVID, decided that the best approach was to take everything that IVI could do, from epidemiology and burden studies in developing countries through developing and testing vaccines in the laboratory, to testing them in humans in clinical trials, and then beyond that to being able to show that these vaccines in the real world function as we would expect. And so we've helped now 14 different companies with various aspects of COVID-19 vaccine development, and have focused as well on advocacy for global equity and vaccine distribution.
Excellent, thank you very much. And Deok Hee?
Yeah, good morning, everyone. I work at the Cicely Saunders Institute at King's College. So basically, the Cicely Saunders Institute has the legacy from Dame Cicely Saunders, who initiated the hospice movement in the UK. So during the pandemic period, we have been working to help the patients at the deathbed or their families. And we have the clinical team in our department, so they are at the front line. And we also do a lot of research to have more idea of who is dying and who needs the help. So we also have the collaboration across 4 countries in the UK and across the European countries. And I have been analyzing the data collected from the frontline workers and researchers. Yeah.
Excellent, thank you. And Hans?
Good morning, everybody. I'm actually a molecular biologist studying in cancer. I now serve as a Dean for Research Affairs of Seoul National University. So I think the reason that I was invited here is because of the movement that I made from last year in SNU and to the society, which is that after the outbreak, I kind of invited a group of people in SNU to do some studies and actually make some videos to outreach to the people, to give them the idea of what this pandemic is about and how could we overcome this situation of that. So that starts from like diagnostics to vaccines and quarantine and everything, and the social impact as well. So those videos were well received by the society. After that, it wasn't planned, but I became the Dean for Research Affairs. So still I'm in charge of taking care of the campus and the research and the academics here in SNU. So this pandemic issue and how we are going to exit from this pandemic is a great thing, great problem for me. So we have established an on-site campus diagnostic center recently, a month ago, to do the regular testings for everybody here, so that until the umbrella for this vaccination, immunization is there in our campus and Korea, that we are trying to keep the normal life by utilizing these test centers. So that's why I think this webinar would be quite helpful for me and for others in the campus.
Excellent, thank you very much. So I think let's begin, to contextualize where Korea is relative to others. So as you know, with the vaccine rollout now, I think, depending on which numbers you look at, the UK is close to 60% in terms of having received the vaccine, around 56. The US is close to 50%, and Korea now is around the 8% mark. So we're seeing, three, for example, different countries that took different approach, and also, two that developed their own vaccine. So what are your thoughts on where Korea sits in terms of its strategy towards the acquisition and rollout of the vaccine? And also, to what extent do you think, particularly in Asia Pacific, the lack of speed of rollout is to do with the so-called sort of vaccine nationalism, and the fact that there was no domestically developed vaccine in this, particularly in Korea, but also in other parts of the region. Would anyone like to volunteer for the first one? The first one is always the most difficult.
Right. Well, I think Jerome is the one who could answer to everything, so I'll just start. Last year, when we heard that there was an outbreak, and it's probably coming to Korea as well, and then it did to the world. Well, anybody who knows any little bit about what the virus outbreak is about, then you could actually guess that it's not going to finish that easy, because it's including not only the vaccine development, but about the people and how people respond. So it's not that easy. And it's not that one country just finishes or exits from the pandemic. It's about the globe. Whole world has to come out from that. So I thought that it's going to take a while, but of course you don't want to keep it for years. Just, with science, you want to have it in 1 year. So we were actually kind of, explaining a lot why you have to wear the mask and why you have to do the distancing. I would like to call it physical distancing rather than the social distancing, but anyway, social distancing. But meanwhile, I was expecting the vaccine, purchasing the vaccine would be done by the government, but somehow the decision was made rather late. I must say that was what happened. That was quite disappointing, but anyway, because the society was relatively safer compared to other countries, that I think people were a little bit maybe just wasn't that sure about purchasing the vaccine, because they wanted to make the right decision. So it was not about the right decision, you have to do it, but it was rather late because of the early success in Korea. I think that was what was going on. Now what I feel is that now that we have purchased enough vaccines to come in, that we will end this game probably end of this year. But my worry is that it's going to be very slow like this. It's not like shooting up and then finishing. It's going to be like a very flattening curve. So as a person in the university, I'm a little bit concerned that maybe after the summer, all the universities, major universities in UK and USA might be opening their campus just like before. Compared to that, we might face a problem that we have opened the campus, but it's not that completely opening, but maybe just hybrid type. So that's going to be a comparison between us and of the major universities outside. So we are kind of concerned for that. So we are trying to kind of cope with this situation that, accepting that the vaccines would be here in a very flat curve, but we are going to live with it. So we are developing some ways to get out of it using like regular testings combined with the vaccination. That's what I think.
Okay, so I think as you mentioned, then maybe rather than a strategy, it was a delay of decision making, and now there's a sort of hybrid approach to try and negate, I guess, the lack of supply, although now Korea has sourced enough. So, and there has been the recent porous global vaccine partnership that's also been announced. So I think there's maybe a recognition that Korea can get that supply and speed up. But what about, for example, Jerome, your thoughts on where Korea has sat relative to some of the other countries that, Korea did very, very well in terms of its prevention phase, but maybe in terms of this strategy, what are your thoughts?
Yes, and so to build on what Hyunsook had said, which is perfectly on target, governments are supposed to protect their people, and that should be one of their biggest priorities. And, when looked at from that perspective, the Korean government has done a very good job. Korea has less than 2,000 deaths. When you compare that to some of the countries in Europe or North America or South America, India, where there are over 2,000 deaths a day, sometimes significantly in excess of 2,000 deaths a day, the Korean experience has been, and the experience of many countries in East Asia, have been remarkable. I think that the problem, and this has actually been a problem in the US as well, is that when one considers the response to an outbreak, you can't think of it in a static way. You have to think of it end to end. So if distancing and other physical measures such as masks were effective, they were only going to be a temporizing solution, as lockdowns were. Lockdowns were simply designed to stop transmission immediately so that the governments would have time to react. What many governments failed to do is to think through the pandemic response from end to end at the start. So as you're putting into effect lockdowns, masks, distancing, putting in testing and tracing and isolation and treatment facilities at the same time, you needed to start working on vaccine development and the development of other medications or more efficient systems for identifying people, isolating them, and getting society ready for the things that were going to be necessary as you moved on into a vaccination phase. Many countries, and that actually includes the United States, found themselves in November of 2020 with the announcement of several vaccines that were now being shown to be safe and efficacious after interim analysis of 2-month data, in the position of having to either order or order more vaccine. And you saw this with the United States. In November, they asked Pfizer if they could have another 100 million doses, and Pfizer said, sure, in June of 2021. Yeah. Similarly, so then you see Korea entering the purchasing opportunities in around the same time frame, and they also were not going to get vaccine until later in 2021. So I think Hyunsook was exactly right by saying, they knew at the point they entered the fray at the point where there was significant evidence that the vaccines, and actually at that point, quite a few vaccines were going to be safe and efficacious. Will there be Korean vaccines? Well, we have to vaccinate 16 billion people. Yeah. And with the United States and the UK and Israel and other countries showing the positive effects of significant vaccination, And with a ramp up in global manufacturing capacity, there will be billions of doses made this year, but will there be enough? And enough to prevent the emergence of further mutants? And I'm sure Hyunsook, as a scientist, has lots to say about the emergence of these mutants and the problem that they may cause. So there will be at least 16 billion doses of vaccine probably required for the first round. But then we have to think about booster doses and potentially doses against the variants. And we're looking at billions and billions of doses of vaccine being manufactured. So Korea is entering the fray a bit late. It has largely preserved the health of its population, and hopefully, I guess by November, or maybe under optimal circumstances, September, 70% of people in Korea will have received at least one dose of vaccine. And the goal will be then to make sure that final complete vaccination is accomplished. Booster vaccination is also planned for if it's needed, and that hopefully the Korean vaccine industry can contribute to the global effort to manufacture the billions and billions of doses that are needed in order to control this pandemic worldwide.
Yes, thank you. And Deok Hee, maybe you obviously have a greater insight into the UK approach as well, but I'm interested in your general thoughts on this topic.
Yes, I think that some people were concerned about the vaccine nationalism. And from the perspective of the public in the UK and the US, I think it was their priority to vaccinate their own people. So somehow, because of the coordination across different states in the UK or the US, they have some stored vaccines which were not used. But I'm glad that the president were supporting the share of the patent of the vaccine, things like that. However, in the UK, we had a problem at the beginning. So now the hearing is going on in the UK, so we'll see. However, they started to vaccinate the people very quickly. So I think it was successful. And people are talking about the herd immunity. And some people say, 75% or 90%. But in the US, they just vaccinated more than half of the population, and they are seeing the plummeting hospitalization and mortality. So I'm quite positive that we can achieve the similar situation by the end of September or October. But at the same time, I'm concerned about the seasonal flu, because last year we had a relatively small number of seasonal flu casualties across the globe, and we do not have enough information to make the flu vaccine, effective flu vaccine, I'm afraid. So if we have the epidemic or pandemic of the seasonal flu, it will be the problem. So I think that we need to make ourselves prepared for the seasonal flu as well. And yeah, that's my,
I think, as you said, that's something which I guess could come with the change of circumstances as people relax and masks are sort of used less, and there will be undoubtedly some effect, I would have thought. But maybe then just to go on to a little bit of the medical side, and maybe Hyunsook might be pertinent to reply to this, but also anyone else can jump in, and that's around what do we know about the efficacy of the different vaccines? Because as you know, there are different vaccines which are said to be have higher efficacy rate for certain age groups, and some are now considered a little bit risky or not risky, and there's a lot of rumor around this. So I wonder, just on that question of the efficacy, what is the sort of confidence level that you have, and then how effective are they in terms of that transition? And I think, Deok Hee already mentioned that the US is seeing a big drop in cases, particularly hospitalization, but I wonder what the early evidence is speaking to in terms of vaccine efficacy. Maybe Hyunsook, would you like to address that?
Yeah, so I'm the most casual person. All right. It is true that these vaccines were approved as an emergency cases. So it means that as people get vaccinated, more people get vaccinated, we have to discover more from these vaccines. So I don't think it's I don't think we have the complete data on which vaccines are more effective over others. We hear a lot of stories on the media, which is actually making some people biased towards like mRNA vaccines. But do we really know that the maintenance of the antibody or how effective they are towards the variants? All these data are very important, but I don't think that it's really conclusive to compare all these vaccines. So I think we are actually collecting all the data. One thing that I worry about the situation in Korea is that because of all the reports coming from Europe, UK, and USA, so these are really different polymorphisms of the genes. But anyway, we hear about the clotting, and we hear about the muscle problem and heart problem, everything about AstraZeneca vaccine, which I don't believe is really related to the vaccination itself, but maybe some of the problems of that person or genetic variants, genetic polymorphisms, the difference between the Asians and the Europeans are not really considered in this situation, but we hear all these news. That brought some of that bias towards mRNA vaccines in Korea, I think. My opinion is that I don't think there's a big difference between the mRNA vaccine or the viral vaccine or the DNA vaccine. It's actually based, we are collecting the data. I think that's more fair to say. So the challenge to us is to, kind of cut out all the emotions, but just provide the scientific information to the public. For that, I'm very grateful for the geneticists and genomics people in UK who have sequenced everything. So I would say that the variants found from UK were very informative to the world. Although because of that, we call that it's the British variant or the English variant. Anyway, so these variants are out there, and Korea has not collected this much of the information, but we have to continue studying on which vaccines are effective towards these variants and how the antibodies are being maintained, how long they are maintained, and do we need the booster shot or anything like that. So my conclusion is that we are still in the stage of doing some clinical trial, I think. Like, as we go on, we are collecting the data. It's not to say that we know everything about these vaccines or the outcome of these vaccines.
Okay, and I think on that point, actually, Deok Hee, in very typical professor style, has a slide on this. So I think that's going to be very helpful for those listening in. So why don't I pass that over to you? And oh, yeah, Jerome.
Sorry, and can I just add a little bit more on this? And that is what we heard in November and all the way through April about efficacy and safety, really, as Hyunsook said, was based on 2 to 4 month collections of information. So it was interim data. Yeah. And efficacy in a phase 3 trial is done in as scientific a way as possible. We try to isolate protection of the volunteer against disease, in this case, mild disease with PCR positive or moderate to severe disease. And so really the experiment, the clinical trial with 40,000 people, is designed to answer a specific question about protection of individuals. What countries are concerned about is protection of society. And that is what we call real world evidence or effectiveness data. And some are beginning to emerge from the countries that were very successful in implementing vaccination early. So for instance, Israel, the United Kingdom, and now some data from the United States, and actually a small amount of data from Korea. And the primary vaccines, as you would expect, are the Pfizer vaccine. In the US, it's the Pfizer and Moderna vaccines. With Korea, there's some data on the AstraZeneca vaccine, as well as data from the UK. So remember that if efficacy, the original report, varied anywhere from 50% to 95%, depending on the vaccine. And it looked like there were huge differences in efficacy. But from a societal perspective, the prevention of severe disease, hospitalization, and death, the things that really matter, for countries and societies. Many of the vaccines, most of them are that have data reported, are above 85% effective in preventing those severe outcomes. The one exception might be the AstraZeneca vaccine. Now there's preliminary data from the UK on mild disease with PCR positivity, that the AstraZeneca vaccine effectiveness against the South African variants, so that's the South African variant listed there, 1351, is about 60%. And it's about 66% against the UK variant, the B117. It's expected that if we look then at severe disease, hospitalization and death, that the effectiveness will actually be much higher. But right now, that's all we have. But by and large, these vaccines are fairly similar, and that would include some of the Chinese vaccines. Sinovac, for instance, in Indonesia, is also reporting effectiveness in prevention of severe disease in healthcare workers of over 80%. So again, effectiveness is going to be important because it's the real world evidence around the vaccine. The data are still evolving, and we still don't have complete data, but effectiveness may actually be a better measure for us, particularly for those vaccines whose efficacy was reported to be lower. They may still be highly effective in preventing the things that we worry about, which is keeping people out of the hospital and preventing unnecessary death. So lots is still happening, and it's really exciting, for those of us who develop vaccines. And then, the other concern, of course, is as this virus is spreading throughout the world, and as we have uncontrolled outbreaks, like as in India or in Brazil, we're generating new mutants. And these new mutants have the potential to be able to undermine $20 billion worth of investment in these vaccines that we have now. So to the extent possible, we need to provide support to the countries with uncontrolled outbreaks in order to minimize the generation of new mutants, minimize suffering and death, and hopefully, restore economies. And I'm sure that there are other opinions on the impact of vaccination on economic growth.
I completely agree. Yeah.
Yeah, I totally agree with you. Yeah.
I think that's the point. I think this idea of sort of effectiveness over efficacy, or the context of that, particularly from a global and sort of governmental perspective. So I think maybe then, Deok Hee, would you like to just quickly contextualize where we're at in terms of some of those strains? And also, I know you have your slide up, but I don't know if it's just maybe
actually,
a little small.
I borrowed this slide from the Twitter, so I think it's to share this information because it is summary of the various the academic literature. And I know that, well,
can I just ask you to expand it a little bit? If you just click on it, it's still a little small for. Okay, that's good. Perfect. Thank you.
So I think that in the laboratory level, it's very important to see the small changes, but at a population level, as Jerome pointed out, it's important to have the effectiveness as a group mixed with the masks and isolation and other measures. So yeah, this is just summary, and somehow we can be still relieved that we have the vaccine, but well, who knows what happened to the major variant. The strand will be the variant from South Africa. So that's the thing. And so I also saw that even the Chinese vaccine was effective at 67% in Chile after second dose. So I think that, well, we can be sure of the effectiveness of the Chinese vaccine at this point, but well, I do not know about the Russian vaccine yet. And now Korea will start the clinical trial of our own vaccine very soon. So we may have another version of vaccine, but as Jerome emphasized, I think that we need to vaccinate other people than Korean people. That's the important aspect of the society, because there is no way to stop people coming to Korea. And we need to pay attention to North Korea. So there is a lot of politics going on between China, Korea, and the US, but I think it's critical to vaccinate the people in North Korea.
Okay, yeah, thank you very much, and very interesting point there, particularly around the support that might be given to North Korea. So I wonder then, we've discussed the efficacy, effectiveness of the vaccine, but even within our discussion, it is already been alluded to. What is herd immunity and what percentages is an adequate amount to really start to bring things down is still up for debate. So I wonder, on that question, what is your thoughts on what percentage achieves that, and then when even in the case that is so-called achieved, are there still countermeasures that need to be implemented past that period in order to make sure that, for example, variants are not sort of re-entered into the country? So anyone like to, maybe Jerome, would you like to venture as to what you think is an adequate percentage?
So I think first, it's important to emphasize that herd immunity does not mean that there will not be further infections in a country. What it means is that if infections are introduced, that they can be effectively contained before the outbreaks become large. So for instance, and I think people remember from the measles outbreaks now in 2019, Korea has vaccination rates against measles of 95%. But when a case comes in, a few people who are unvaccinated or unvaccinated, like infants, essentially before the age of vaccination, can be infected, but the infections don't spread. So in the same way, as you vaccinate more and more people, you start to see decreases in the number of infections. And the UK and the US, which are around 50% vaccination, so not near the 70% threshold that some people had talked about early on, are really seeing dramatic reductions in the number of infections. So, and I'm going to use a number. It's the number of infections per 1 million population, because it's easy to index that way. And so the UK, during the height of the outbreaks, was over 200 infections per million population. By comparison, Korea has been around 10 infections per million population. With successful vaccination, the UK has dropped to about between 30 and 40 infections. So a really dramatic decrease. They're not yet at that magic 70% threshold. The United States also is not there yet, but the United States dropped from 400 infections per million to 100. So just kind of showing you that as you ramp up protection, you really are going to start to see decreases in the number of infections, hospitalizations, and deaths. Now, the big concern here, I think, and this may adjust the number a bit, is that the highly efficacious vaccines like Pfizer and Moderna may be easier to understand than the vaccines with lower efficacy, but with good effectiveness. And I'll use an example from what IVI does. So we came up with an oral cholera vaccine. Now, the efficacy is 55 to 60%. But when you vaccinate half of an Indian city, the number of cholera cases goes down by 85%. So clearly, you're protecting the people in the city with effective vaccination, even though the vaccine itself has efficacy, in the 55 to 60% range. So I think we should just remember that what we are seeing is a decrease in vaccination, decrease in infections as a result of vaccination, that we do need to vaccinate as many people as possible. So let's not use 70%, let's vaccinate as many people as we can possibly vaccinate with the full regimen. So it's not enough to get a single dose. And then we're seeing cases in the United States of breakthrough in people who got a single dose. And we know that, for instance, with the Pfizer vaccine, there appears to be an increase in the number of infections about 10 weeks after the first dose. So again, it's important to use the vaccines as the clinical trials had deployed them. And if that's 2 doses, we need to fully immunize people up front. And then, as we're looking now further on, we may need to use booster doses. And I think there's been a lot of discussion recently about how we optimally boost people and what the timing of that is. Some of the vaccine company CEOs are saying, well, we think you may need a boost at 6 months. And Dr. Fauci said, it's actually not up to them to decide. Let's look at this scientifically. Let's look at the data and decide when booster doses are. So again, I think herd immunity is an important concept, but it's actually, from a societal perspective, in our interest to vaccinate as many people fully as possible, as quickly as possible.
Yeah, and I also think that it's important to have the priority in the society So for example, the healthcare providers and the people age above 75 and people with the underlying diseases, I think that in Korea, well, they are relatively, well, fully vaccinated by September sometime. So I think that that's the good indicator, and ages the 60s and possibly the late 50s will start vaccinated by fall. And I'm sorry to say that the Taiwan is at high risk right now. And unfortunately, they did not vaccinate the healthcare workers or the old people or people with the underlying diseases. So they will experience a huge casualty, I'm afraid. So I think that that's the lesson to other countries or future pandemic of the different diseases. So we need to have the priority based on the medical or scientific background. And well, I think that the Korean people are coordinating with the government policy to have the priority. So basically they are on the queue waiting for their turn, very orderly. So I like that point, yeah.
Well, I cannot agree more with both of you. One more thing, very interesting thing going on here in Korea is that we have, I mean, right now, the most abundant vaccine is AstraZeneca vaccine. And because of some of the news against AstraZeneca, which believe it or not, around 50% or 60%, only 50 to 60% compared to how Koreans are ordered, are saying yes to receive the vaccine. Right now, we are having age over 60s to have the vaccines. So that means that there are remaining vaccines. So like myself, what people are doing is that the young people are actually rushing into this application app to kind of register to get the vaccine, which has not, which was left out from the not turning up. So that's one of the things which I think is a very good idea, just vaccinate everybody outside the age range. So this is going on in Korea. So we, although we have very low rate of vaccination going on because of the sequence order to vaccinate the the people in the clinics and the aged people and the risky people, that was a very good strategy. And now we have some left out, which gives me some opportunity to get vaccinated. So those are the things interestingly going on in Korea.
Right. And actually, just on that point, it sort of brings me on to, and maybe it's worth taking one sort of step back, because as you mentioned, in terms of the availability of the AstraZeneca, as of 10 days ago, I'm on a waiting list to receive it because of the cancellations. And so, you know, I'm well aware personally of that program. And I think there's an app launched today through Kakao, which will allow that to be facilitated more efficiently than me calling 9 different hospitals in Seoul. So, so I think, yeah, that brings me on to first thing, and maybe Jerome, you can speak to this. It's, you know, from when this first began, it was all, you know, the discussion was, you know, it takes 10 years to develop a vaccine. You know, it's going to be take a long time, and everyone's rushing to it. And the UK and the US in particular, you know, sort of very quickly were able to conduct clinical trials and regulatory wise pass it and deploy it. But what really allowed for that? Like, how did this development happen so quickly? Is that a consequence of just great minds being put to a task and big investment? Or was there also, you know, in conjunction, some sort of regulatory sort of liberalization in order to allow something to be passed that maybe wouldn't have ordinarily been passed because of the context of the problem? So what allowed for such a quick development of vaccines?
Yeah, that's a great question. And it happened as a result of several opportunities. And one of them is that the developed, what we call the stringent regulatory authorities, the best of the regulatory authorities, the EMA in Europe, the FDA, the MHRA in the UK, had recognized that there might be times when they had to expedite the processing of applications for clinical trials. And so they already had a mechanism, or they had thought through the potential for a mechanism to allow vaccines to be moved more quickly through the pathway. And one of the things, for instance, that they did was for vaccines where there was a lot of experience with a platform. So, for instance, with the RNA vaccines, thousands of people had gotten RNA vaccines, often for cancer or for experimental vaccines against rabies and others. The FDA said, well, you know, we know that these platforms are useful. They're by and large pretty safe. So we'll allow you to move into humans before you complete all the animal testing. But they only did it in the setting of those vaccines where they felt very comfortable that the platform itself had significant human experience and didn't appear to have any difficulties. And actually, they'd already started to talk about that before the pandemic. So this had been something that had been prepared for. The other part of this is, you know, a company can develop things quickly, but when it does that, it runs the risk, and remember now, 90% of vaccines don't make it all the way from the laboratory to licensure. So there's a pretty high failure rate. So a company could accelerate the process, but it runs the risk of failure. And so what the US government and what CEPI, the Coalition for Epidemic Preparedness Innovations, which actually the Korean government is a part of, did was they said, okay, you know, we understand what the risks are. We will pay you to develop a vaccine and purchase the vaccine in the end. So we want, you know, here's $1.4 billion. We want 100 million doses in the end. And when you do that, the company says, okay, we have to do this as quickly as possible. There's a reward at the end of this. So it's de-risked. There's a clear purchaser. We can do this. And so they did. They picked, they actually did look at different doses, but they accelerated it as quickly as possible. And you know, we had guessed originally that it could take 9 to 12 months, and most of them were done in 10 to 13 months. And that, I think, was a really important, probably one of the key concepts that came out of this was that we can move whole inactivated vaccines like the Chinese vaccines, the viral vector vaccines like the one from Oxford University and AstraZeneca, and RNA vaccines through the process in 11 months. And that is actually an important proof of principle, one of the maybe the pearls of COVID, that we can actually do this in a setting that we need to. The other part of it was, could we manufacture enough? And I think everyone's seeing now that you had to start planning for the manufacturing when you were planning the clinical trial, because if you start planning now, it's too late, and it's going to take months to ramp up production. So again, thinking through the whole process, you know, I don't know how many people use Gantt charts, but one giant Gantt chart of all the different things that go between starting in the laboratory and injecting a person in the arm have to be thought through at the government level.
And then maybe then, and this can be for Hyunsook or Deok Hee, you know, so that explains, you know, how we were able to get here. Then, you know, the next step, I guess, is they're developed, and, you know, I think governments are comfortable with the effectiveness and efficacy, but of course, suddenly you have a situation where, and you spoke to it now, Hyunsook, where a large part, 56% of the Korean population are refusing an available vaccine, which, for example, if you look at my own country, my entire family has had, and everyone I know has had this vaccine. And so how real are the risks in terms of the side effects, and to what extent do you believe that this is a real concern for people to have, or is this just is it just a consequence of just unwarranted anxiety?
Let me start. I have mentioned briefly earlier, but the data on this blood clotting that people worry about, it actually comes from the Western population. And if you compare the genetic polymorphism between the Koreans, Asians, and Europeans, there is a meaningful, significant proportion of the genes which are polymorphically different. And in Korea, we don't have sufficient data to say that this AstraZeneca vaccination actually really caused blood clotting to a severe level. And I heard that there was one case reported which the government said maybe this is related, but that was all. So I think that the risk is very, very low compared to even the popular flu vaccine. This AstraZeneca vaccine is safe, I think. So, I mean, there's kind of more, I mean, like the media news is actually making people to panic, but I think this should calm down as these people like, you know, canceled vaccine, people like me rushing towards this canceled registration. So these are going to kind of change the atmosphere, I guess. So it takes time, but maybe in a month or so, as the vaccination goes on smoothly, these worries or concerns would calm down, I guess. And as Jerome would be doing very well, I think collecting data in this country itself is very, very important. We shouldn't only look into kind of rare reports from coming up from outside, but because we do understand as molecular biologists and geneticists that the genetic polymorphism does matter towards this virus and also to the vaccines as well, maybe. So we have to collect the data and calm down the people maybe to persuade people to get vaccinated, because that's much better than worrying about getting infected and getting into hospital.
I think that no medicine or no health policy is without politics. So we've seen that in the US or in other countries like Israel or in Japan, the politics sometimes dominates the vaccine enrollment or things like that, or social distancing. So I think in Korea, the politics somehow prevented people from wanting to get vaccinated. So that should be resolved by the politics level or the social level. However, as a scientist, all we can do is provide the evidence. And at the same time, when we say that side effect, I think we should emphasize that it is adverse effect we are concerned about, not the side effect. So adverse effect, we have some statistics. So for example, 1 out of million people. That's from the public health perspective. But from individual, the person's perspective, it is just 1 or 0. So people are thinking about the possibility of 1, not 0. So I think that it's reasonable to think about the 1 possibility, but we need to provide enough information and urge the politicians to make the reasonable decision to persuade people to side with the 0 possibility rather than 1.
Right. So I think then on your points are exactly right. And let's make the assumption that, people do begin to get vaccinated and Korea reaches, a point where it's, numbers akin to the UK, US. And I guess the challenge we have now looking more at the end game is that you have a global imbalance as to the rollout of vaccinations. You have a global imbalance as to infection rates and different strains. So I wonder and this is open to any of you. So what do you think this means for things like reinstituting international travel? And I'm actually now I'm aware of time, so I'm integrating some of the questions that have come through. Someone was asking, what does that mean then for agreements on, for example, a sort of so-called green passport? How do we deal with this imbalance in order to get as quick as possible back to some sort of normality in terms of international travel, but also just economic standing? Maybe Jerome, would you like to go with that one?
Sure. So I think the problem with international travel is that it has to be regulated between countries. And so unless the countries come together and do a treaty or a general agreement, then the Korean government will have to negotiate with other governments to accept, for instance, the Korean vaccination certificate. Or, within the European Union now, they're talking about allowing American tourists in because America has a fairly high rate of vaccination, but proof of vaccination will be required. They aren't offering the same thing to Korea yet because Korea doesn't have the same level of vaccination. I think that maybe, and this is just thinking now, I'm not a Korean citizen, but I live in Korea. For the average person in Korea, being able to go out with friends and family, being able to visit people, parents in a nursing home, being able to go to church or to a theater or to other public venues is going to be very important. And this is actually a really critical point. Later, since a lot of travel is not business related, many people, the average person, may not consider it all that necessary. Now, I travel a lot on business, and so getting these agreements into place could be very important, particularly on return, because right now we have to be quarantined for 2 weeks on return. So we're planning a trip to the United States to see my daughter graduate from university. And on return to Korea, so my wife and I both have been vaccinated, and we will be quarantined for 14 days, which, it's the rule, we have to follow it. But it would be great if the Korean government, along with other governments, both in the region and, in North America, Europe, and elsewhere, are able to put together a set of agreements around what it would take in order to remove the quarantine requirements, because it's a big impediment and makes travel for necessary work very difficult.
Yeah, actually, on that point, just to interject, we are also at the moment, drafting a letter which will be going to the Korean government, and I know that the American Chamber, for example, is doing the same thing, just to ask that steps be taken bilaterally between our respective governments to try and change that, because, as you said, that's a big impediment, and it seems to me that it's in both those countries' interest to agree to some sort of at least reduction on that sort of timeline. So yeah, point well taken, and something that we're working on behalf of our members as well. Not only for business travel, but there are also families that haven't seen each other for well over 18 months, and so my mother really wants to see my second son, so I need to get her here without 2 weeks in a hotel. So what about then for anyone else in terms of that point of how? And maybe I guess I'm also interested in, there's not much time left, it's not only about international travel, but when do we get to a point where we see really a sort of global recovery, more sort of midterm?
I think that's one worry that we have, like as Jerome says, that I completely understand that this kind of travel should be done between the agreement of the government, between the governments. That being said, what would happen is that countries like India, we would not be able to travel to it or have the visitors coming from India, not until maybe next year. And so the world is now becoming more kind of differentiated. It's not the kind of free communicating or free visiting, but also this world is being divided after this pandemic until it's completely gone. So it's going to make people, it's going to change the way people think and way people face other people. Like, the difficult thing going on about the racism and everything is going to maybe continue. So I worry about that. So as a scientist, I of course visit a lot to Europe, UK, USA, and all the other places, but I can see that because we have to control this pandemic, these sad things would happen, and maybe we have to, study more and just boost up people to discuss on this very important matter more. So it's not only on the health, but about the division of the world, maybe. Vaccinated versus non-vaccinated.
So I think that what we had the experience from Ebola virus and Zika virus, and it was not the pandemic and it was limited, limited in certain continent rather than several continents. And I'm sure that the high income countries, they did not have the threat from Ebola virus or Zika virus. So at that time, they did not mind the people were in that continent or traveling between those countries somehow. So now the people in the high income countries, they are experiencing this problem. So I think that somehow we are selfish or rude, and now it is the time to think more globally. So we should not ignore the malaria or cholera in other countries as well, because the high income country, people travel to the cholera or malaria pandemic area and endemic area, and they stayed in the nicer hotel. So that was the solution at that time. But now we need to think more globally. And I'm sure that that's Jerome? Yeah.
Oh, no, sorry, I didn't mean to stop you. I was signaling to Sean. Please, go ahead.
Yeah, so that's my, understanding of the situation, yeah. Probably it is not from the science or from the business, things like that, but yeah.
Thank you. Jerome?
Yeah, so again, just to reinforce the things that Deok Hee and Hyunsook had said, we work a lot in Africa, and a lot of the African countries haven't reported a lot of infections. If you look at the map, or the map of vaccination for that matter, there aren't that many, there isn't much uptake or as much disease as one might expect there is in Africa. And I think this is a plea for more understanding for countries like Korea, the United States, the UK, and the European Union to help the African countries understand through testing the number of people who are infected, and then through sequencing where the variants are. Because it's those infections, if they're having uncontrolled outbreaks that we are unaware of, we run the risk of developing a variant against which the vaccines no longer work. And so it really is a plea to help us better understand where the pandemic is and how bad it is in all the parts of the world, so that we can prioritize the shipment of non-pharmaceutical things like gloves and masks, and also vaccines in order to help countries control pandemics that they might otherwise not have known about. And we are seeing in South Africa and Egypt, for instance, significant in numbers of infections, but those are not the poorest countries on the African continent. So again, support for health systems, including surveillance and sequencing, I think is going to be critical if we're going to get a comprehensive solution to the pandemic.
Right, and actually that brings me to I'm aware of our time, so this is a question we're really looking forward and sort of wrap up the discussion, although I have to say I could sit here and do another hour or two, but I think you guys are very busy, so I'll make this the last question. In looking forward, there's already been a prediction that it won't be long before there's another pandemic, right? And I think if you look at the outbreak of COVID, there have, of course, been examples of international cooperation, particularly on development of the vaccine and sharing of best practices and maybe PPE distribution, manufacturing. But there have also been, as was mentioned by Deok Hee, division has been part of this. There's been a fairly nationalistic approach, sometimes a bit of a blame game in terms of the origins of the vaccine and also how certain countries have been developing their strategy to counter it. So looking forward, assuming that 7-10 years from now there's going to be another pandemic, what do you think needs to be done before or now really to maybe as a global community be able to counter the rise or the outbreak of another pandemic with the view of the learning that we've taken out of this one? So, and I think it's an important question, so I'll go to all three of you. So maybe Hyunsook, would you like to sort of give your opinion on what you think needs to sort of be done?
Yeah, I think we have discussed this matter quite a lot last year when we were making this video series. First, I think it's that the society has to be prepared, the system, like, getting a very quick diagnosis. So there would be we have to establish a system where we kind of recognize that there's a virus outbreak, and you have to kind of localize that, not to spread outside. So there must be a system for that, and also to diagnose as many people as possible without that many difficulties, and very low cost, of course. So these are the areas that scientists has to get in and to develop. After that, of course, like in Korea, we have made this platform of making mass vaccine production. So that's quite important, I think. So people are now aware of these infectious diseases. So the basic studies for that would go on. So I think there are so many things to be developed, and maybe it started already, that the most important thing for everybody is now the infectious disease. So the science area is changing as well. So what I think is that the scientists and the clinicians and the social studies people should talk much more. Like, because it's not only about the science or not only about the medicine, but the social strategy and the system of the society and of the world as well. So we have learned that, we were only doing our work, not really talking with people outside our field. But now we are aware that we must kind of abolish all the barriers. Otherwise, we cannot actually react to these kind of pandemics or the outbreaks. I think we have learned about the risks and how we have to get, how we can get over with it. It's a good lesson.
Right. And Jerome, what are your thoughts in terms of what needs to be done to sort of mitigate a possible, next outbreak?
So I think if you think about it, working together, and that would be organizations like CEPI could be made stronger. COVAX, which is a first ever attempt to share innovative technology in the first year of introduction in countries of all income levels. Companies working together to, have SK Bioscience make the AstraZeneca vaccine and the Novavax vaccine, have a big vaccine company like Merck make the Johnson & Johnson adenovirus vaccine. Those are unheard of things. So working together has been really important. Working smarter, and I think we talk about this all the time, regulatory efficiency is one of them. But it also gets to the way we think about booster doses and mixing and matching, or the second wave of, quote, better vaccines. I mean, and so a lot of this working smarter. And then finally, I guess, thinking with the end in mind. And the end is, the preservation of human life and the avoidance of illness. But it's also, having strengthened healthcare systems to be able to deliver vaccines, not only to children, 80 to 85% of children around the world get their basic vaccination through healthcare systems. But now we have to vaccinate everybody. And that expansion of healthcare system strengthening is something that really very badly needs to happen, as well as regional manufacturing. And I think Korea, for instance, has been very upfront about vaccine self-sufficiency. It has been for the last several years. And all of those kinds of efforts, thinking with the end in mind, which is the preservation of human life and the avoidance of illness, I think is going to be really important. So those three things. Thanks.
Yeah, I think that it's important to empower every country, especially low and middle income countries, so they do not have the capacity to produce the testing kits or even vaccine or other treatment drugs. So I think it's important to share the knowledge and experience, and sometimes support or donate money to those countries to have the capacity to deal with their own problem. So I'm afraid that we will have a very similar pandemic in 5 years or less than 5 years. So even if we try to prepare ourselves for those things, we will see the new horizons. So we never know. So I think that self-sufficient or self-fulfilling ability, that's the important thing.
Okay, thank you very much. I think, as you mentioned, it's about working together. I think private sector, public sector, and also in terms of research and education in order to get it right for next time. And I think part of that are discussions like this. I think you guys have been absolutely fantastic, informed experts in an area where I think our members are very, very interested, not only from a business perspective and what the impact will be in terms of their companies and the economy, but also from a personal and also family perspective. So thank you very much. It's been genuinely very enlightening. It's the title, The Endgame. So I hope that I won't see you again, even though you guys are all absolutely brilliant speakers, because then there'll be nothing to discuss, right? That's what I'm hoping. So let's hope that 6 months from now we're not discussing an extended end game, and that indeed actually things are well on the way to a recovery. So let me wrap that up now and just thank everyone for attending. And again, thank you guys for being here today. And we will be sharing the content on our website. So if you're interested as a participant, as a attendee, please do go on there. And in terms of some of the questions, we did get a lot. And so I integrated as many as I could. For those that we couldn't get to, I can only apologize. And, it may be the case that we may think about another COVID-related webinar and also invite these guys back. So maybe we can tackle those at that time. So thank you, everyone. And thanks again, guys.
Thank you.